I've given a few presentations on the impact of COVID. The presentation is a funny presentation because it describes really quite a devastating impact on how what COVID has on lung cancer. So it's a really quite sad presentation in some ways, but at the same time it's positive because this whole process of what happened during COVID has shown us that what we were doing and doing quite well with before COVID, we just need to do more of to mitigate the impact and recover from what we're doing. Essentially what happened when we locked down services is we turned off early diagnosis activity in general, and in particular presentation of patients when they got symptoms. The necessary message to control the pandemic was stay at home if you have a cough. And the problem was that people did that. They really did obey. They were fearful and they just didn't go and see their general practitioners. As a result of that, we saw a 30% reduction in the number of people that were diagnosed with lung cancer, which did not recover, which means, sadly, they died without even getting a diagnosis. In fact, some of them may have even been labelled as COVID. Who knows? But they weren't diagnosed with lung cancer, and there's been no recovery. We still don't see a full recovery in the number of urgent referrals for suspected lung cancer even now. So a long way to go to change things. Before the pandemic, we were doing quite well. We got a screening program going, we got early diagnosis initiatives and awareness campaigns, and this is a sort of natural experiment. Turn off that and this has a devastating effect. We saw a reduction in survival, we saw a reduction in resection rates, reduction in all treatments. It really did take us back 20 years ago. All the progress we've made in survival in 20 years was undone. So what we're doing now is we're really going back for it again. We're redoubling our efforts on the screening program. We're thinking about new ways of trying to get awareness and early presentation improved. So there's the Roy Castle Lung Foundation Spot the Difference campaign, a number of other documents that have encouraged awareness and early diagnosis, and some national initiatives on this in the UK. And then also at the same time, we're thinking about the primary care backlog. In the UK, we have to go through a primary care practitioner or an emergency route to get to our lung cancer teams in the secondary care sector. And at the moment, people are using the emergency route quite a lot, and that's always a delayed route and it's always bad outcomes. So we're thinking of things like a cancer concern hotline, where awareness campaigns are linked to a number. You phone the number, you speak to someone quickly and easily. They triage you on the basis of an algorithm, and then you go straight to a CT scan if you're at high risk. This is a way, I think, of getting patients that find it usually difficult to access primary care services straight into our services, and that's one of the things that I'm trying to push at the moment.